Okay, good morning and good evening to everyone who are present today. Thank you for spending time with us tonight on this live webinar on advancing pharmacy practice with postgraduate studies. Okay, before we start, I just want to highlight that there are two other speakers that we have today, Dr. Palnisamy as well as Ms. Priya. Okay, before we and myself is Dr. Wong Pei Si. I'm the Associate Dean of Teaching Learning and of course the moderator of the session today. Okay, before we start the session, I just want to highlight there's a few housekeeping rules for all of you. Okay, we have all muted all your microphone for all of you. Okay, so hence if you have any questions, you shall see that there is basically you shall use the Q&A panel at the bottom of this page. So if you have any question, just put in there as you're listening to talk and all that. The other thing that I also like to highlight is that the live webinar will be recorded. Okay, we're going to have two plenary sessions today, and then we're going to follow by the question and answer session. So, which means that all your questions will be answered towards the end of the plenary. Okay, and without further ado, I'm going to just highlight to you that our first speakers today, okay, Dr. Palnisamy, okay, who is currently the program director of the Master of Pharmacy Practice, okay, and he's also the senior lecturer in School of Pharmacy. So, and of course, Dr. Palni is going to talk about a Master of Pharmacy Practice program. Okay, Dr. Palni, are you ready? Yeah, you need to unmute yourself.
Yes, Doctor, I'm ready.
Okay, all right. Yeah, you can go ahead. Thank you.
Yeah. Thank you, Dr. Pei Si, for the brief introduction about the program as well as me. And hi, everyone. Very good evening to all. And this is Dr. Palnisamy Sivanandi, the program director of Master in Pharmacy Practice program. Today, I'm going to briefly explain you about our Master in Pharmacy Practice program. And we used to call it as MPP, that is Master in Pharmacy Practice. And the full-time duration of this program is 1 year, and the part-time duration of this program is 2 to 6 years. Every year, we have two intakes, the first intake in March and the second intake in September. Okay, so we have two intakes per year. Okay, and if you see the overall the program, we are offering this program, Master in Pharmacy Practice program, as a full-time and part-time option. So the students, those are graduated recently, they can choose this program as a full-time. If you're a working adult and without compromising your professional duty, you can take up this program as a part-time. Okay, so you can choose the streams, whatever we offer. So we are offering 4 different streams in our MPP program. Okay, the first stream is clinical pharmacy, and the second stream, social and administrative pharmacy, and the third one is pharmacy management, and fourth one is clinical research. So based on your field of interest or where you want to excel in the future, you can choose the stream. Okay, and so in each and every stream, we have 5 to 6 modules. There is a TAT modules along with the 2 research modules. Okay, so all these 6 to 7 modules will be delivered across 2 semesters. As you know that our program is for 2 semesters, that is full-time 1 year and part-time 2 to 6 years. So the total credit hour in our program is 40 credit hours. And the most notable point is wherever you work, you can choose that place for your attachment. Okay, in each and every stream, some of the module have attachment, either it may be a clinical attachment or maybe industry attachment or maybe community attachment. Okay, so based on the stream, what you have selected, you can choose the attachment site and you can carry out your attachment. Okay, so it is more flexible without compromising your professional duty. Wherever you work, you can choose the attachment site. Okay, and also we are following the student-centered learning philosophy. Okay, as we are an adult learner, okay, teaching adult learner by using a didactic lecture is not appropriate way, right? So that's why we always choose the student-centered learning philosophy to deliver the teaching and learning contents. Okay, and if you see, as I mentioned earlier, we are offering 4 different streams. The first stream is clinical pharmacy. Suppose if you want to excel, in clinical pharmacy area, maybe as a clinical pharmacy manager, or maybe some higher position in the clinical setup, you can choose up this clinical pharmacy stream. And we are offering research methodology, evidence-based practice, clinical pharmacy practice, even pharmacoeconomics, as well as clinical pharmacy practice and services. So in this stream, you have to take the hospital attachment. If you're working in a tertiary care hospital, you can take your attachment in your own hospital. Okay. So along with this 4 or 5 modules, you have to take up the research project module, and this will be concurrently you are going to take the research project. Okay. The second stream is social and administrative pharmacy. If you want to excel or if you want to go higher position in the community setup, then you can choose up this program. Okay, this stream, social and administrative pharmacy. There are about 6 modules are there in this stream along with the 2 research project module. Okay. And the third stream is pharmacy management. Let us say, for example, you want to excel and a pharmacy manager or maybe some managerial position. Okay. So instead of going for any different management courses, you can take up that pharmacy management. Okay. This pharmacy management will give you a lot of insights about the managerial skills. Okay. For example, pharmaceutical marketing and ethics, management of healthcare institutions, business administration, as well as people management, pharmacoeconomics, and also entrepreneurial leadership. So along with this 5 to 6 module, you can take up the research project module in the pharmacy management stream. Okay. And the next stream is clinical research. Okay. Suppose if you want to work in a clinical research area or clinical trial area, you can take up this clinical research. Okay. So we are offering evidence-based practice module, clinical research and GCP, good clinical practice, regulatory affairs, clinical trial and data management, as well as research projects. So if you want to work as a clinical research organizer or a clinical research associate, you can take this clinical research stream. Okay. Okay. So overview of this pharmacy practice, all this knowledge-based, contents are delivered through face-to-face lecture as well as online lectures and case-based discussion. The main point, the main notable or unique point, okay, in our program is we are delivering the content through face-to-face as well as online. Okay, 40% of the content will be delivered face-to-face and remaining 60% will be delivered online lectures. Okay, and the skills related, the knowledge as well as skills related things you can learn through the workshops as well as presentations and placements. Okay. And coming to the program development and delivery, as I told you earlier, we are offering the program, the teaching, learning and content through student-centered learning philosophy. Okay. So instead of going for didactic lectures, the weekdays are mostly dedicated for the guided reading. Okay. So all the guided reading materials are already uploaded in the e-learn portal. The students, those are taking up this MPP program, Master in Pharmacy Practice program, you can use the weekdays. Okay, according to your convenient time, you can take the guided reading materials and you can read in your own pace. Okay, and weekends we are delivering the lectures, plenary, e-discussion, all the synchronized activity, face-to-face activity will be delivered in the weekdays. Okay, in the weekends. So weekends only for the face-to-face delivery and weekdays mostly for the online teaching. Okay, mostly guided reading. So if you see all the teaching and learning contents, we are delivering through guided readings, lectures, plenary, e-discussion, tutorials, seminars, and presentations, then case studies, projects, as well as problem-based learnings, okay, assignments, clinical attachment, as well as fieldwork. Okay, so all these course content, the Master in Pharmacy Practice course contents are delivered to make you a critical thinker, a problem solver, as well as decision maker and analytical thinker, okay, and also a lifelong learner. So all this learning philosophy we embedded in our Master in Pharmacy Practice program to be an independent as well as skillful pharmacist in the future. Okay. So what are the career opportunities? So whenever we give any talk, whenever you think about any program, the main point is what are the career opportunities I can get after completing a program, correct? So here, if you're choosing a clinical pharmacist team, you can work as a clinical pharmacist, maybe a senior clinical pharmacist, therapeutic area experts, or pharmacovigilance specialist, as well as health service researcher. If you're selecting the pharmacy management stream, you can work as a pharmacy production manager, pharmaceutical marketing manager, business development pharmacist, as well as entrepreneur leader. At the same time, if you are choosing the social and administrative pharmacy, you can work as a community pharmacy manager, community health worker, wellness consultant, and corporate manager or healthcare manager. Okay. At the same time, if you are selecting the clinical research stream, you can work as a clinical research associate, clinical research organizer, clinical medical writer or technical writer, then clinical research manager, intellectual property executive, as well as new drug development research expert. Okay, so these are some of the key area what I explained as a career opportunities, but the opportunities are very, very plenty for the students, those who are completing Master in Pharmacy Practice program. Okay. And why we need to study the pharmacy practice at IMU? As you know that IMU is a well-established private medical university in Malaysia, and IMU is a leader in health professions as well as health science education in Malaysia. And notably, in our program, we are giving options for the students to choose the pathway. Okay, so you can choose a program stream, whether you want clinical pharmacy or social administrative pharmacy or pharmacy management or clinical research. Okay, so based on your interest, based on your research experience, or maybe where you want to excel in future. Okay, so you can choose any one of the stream and you can do the best in your studies. Okay, and most importantly, there is a flexibility for working professionals. When you're working in a government sector or maybe a private sector, okay, when you're taking any program, you may think, do I need to compromise my professional service? Correct. Because as I'm a working adult, do I need to compromise? Actually, here, the main point is you no need to compromise your professional duty. You can work at the same time you can study. So there is a flexibility for working professionals. That's why we are delivering all the teaching and learning content, especially synchronized activities on weekends. Weekdays, we do not have any classes. All the weekends, all the weekdays are dedicated for the guided reading. Okay. And we are providing adequate support for the students to learn better from our program. Okay. The course contents are prepared as well as delivered by the pharmacy experts as well as healthcare experts from Malaysia and across the world. Okay. And if you see, we have highly qualified, very dedicated faculty members, those are having multiple years of experience to deliver their best in our MPP program. Okay. And coming to the assessment component, as we are an adult learner, testing an adult learner by using a MCQ type of written examination is not an appropriate way. That's why in our MPP program, we do not have any end of semester examination. So all the assessments are in-course assessment. Most importantly, it will be a written assignment or maybe a critical review report or maybe call test or maybe case reports or projects or maybe a presentation. Okay, so we do not have any end of semester examination. Okay. So coming to the unique features of our MPP program, as I told you, we are offering the MPP program with multiple options to choose. That is clinical pharmacy, social and administrative pharmacy, pharmacy management, as well as clinical research. Then we are offering full-time as well as part-time mode and also blended delivery. The weekdays are mostly dedicated for online schedules. All the learning materials are uploaded in the e-learn portal. You can access the online materials anytime and anywhere. And the weekends are mainly dedicated for face-to-face sessions. And we are giving part-time option for the working adult. You can be able to complete the degree within 2 to 6 years without compromising your professional duty. You can complete the degree and you can continue in your own pace. There is no urgency. You can continue on your own pace and you can be able to complete the degree within 2 to 6 years. Okay. And the research in pharmacy practice. Okay. So along with other taught modules, you can take up the research project modules. There is no separate dedicated, research project module, research project semester. Along with other taught modules, you can take up the research project module and you can complete the research projects. Okay. And we have involvement of practitioners in teaching, not only from IMU, even from the public university, private university, Ministry of Health, as well as business sector, industry, to deliver the best to our students. Okay. And always we are moving towards advanced technology. And as IMU, we are always follow the advanced technology. Even in our MPP program, we are using the advanced technology to deliver the teaching and learning content. Okay. And if you see the MPP admission and progress trend, we have started this program in 2017, and it is the 7th year for us to continue the program. Okay. And whoever selected this program from 2017 to 2019, all the students have completed the degree. So very good progress report we got. And each and every year we are getting minimum 10 students in our program. Okay. This shows the success of our program as well as the working adult willingness to take up our program. Okay, so this is success, and also you can see the uniqueness of our program. So every year we are getting consistent number, and the students, those who register in our program, are consistently showing their improvement and also their progress. Okay, a good number of students are currently doing their taught modules as well as research modules, and you can see the trend. Okay, so these are some of the the feedback from our proud alumni. You can see the their comments about our program, about the delivery of the program, as well as the way how we committed to deliver our course to the students. Okay, most of our students are working in Malaysia and also abroad. Okay, we got the students from multiple countries, not only from Malaysia. If you see, some of the students are from Sudan, some of the students from Nigeria and Qatar, and some students are from Philippines. Across the globe, we have the students, and they're working in a very good position. Okay, in a managerial level, or maybe in a clinical area, or maybe academicians. Okay, and where they're currently working. If you see, most of our students, those who graduated from MPP, the proud alumni, they're working as a clinical pharmacy manager in Malaysia as well as abroad. And they're working as a pharmacy manager, even the retail pharmacy, chain of pharmacies. And they're working as a manager in industry. And notably, some of our students are becoming entrepreneur. Okay, they started their own pharmacy, and they acquired all the knowledge and skills how to develop a business from our program. So with that experience, with that knowledge, they became an entrepreneur. Okay, now they started multiple chain of pharmacies, and most of our faculties are working as academician, even in IMU and also other public university and also overseas. Okay, they're working as a wellness coach as well as trainer, and also they're working as a clinical pharmacist and many more. Okay, so these are some of the photographs of our proud alumni, and not only in academic, even our proud alumni are working in the armed forces as well. Okay, so they are working in academic as well as industry, and also in clinical area, hospital area, community area. Okay, so these are some of the evidences for us to share with you. Okay, about the proud success of our program. And if you have any doubts about our MPP program, you can Google it by using www.imu.edu.my, or you can directly contact me. This is my email ID as well as a WhatsApp number. You can contact me anytime if you want any information. Okay. Thank you.
Thank you very much, Dr. Palani. Yeah. So I hope that Dr. Palani's plenary are able to give you some idea and of course overview about our Master of Pharmacy program. Okay, and of course, just to remind you again, there will be a Q&A session at the end of the two plenaries. So if you have any questions in mind now, please make sure that you put into the Q&A panel. Okay. And of course, our next speakers, I would like to give a little bit introduction about it. Okay, our next speakers is actually Miss Priya. All right, Miss Priya is our graduate of Master of Pharmacy Practice. All right, and she actually completed Master of Pharmacy Practice under the clinical pharmacy stream. Okay, so we have her today so that she can give you a little bit and tell you a little bit and share with you about her journey. All right, in Master of Pharmacy Practice. Okay, and of course, and at the same time, I also want to highlight to you, Miss Priya is currently a lecturer in IMU. Okay, Priya, all right, would you like to share your full screen, Priya? Okay, all right. Okay, Priya, are you ready? All right.
Is it in a full view?
Yes, you are at full view now. Okay, we can hear you well. Okay. All right, so we'll have you, Priya, now to start. Thank you.
Okay. Thank you, Dr. Wong. Hi, everyone. A very good evening. I hope you're doing well. Okay, my name is Priya Manirajan, and I'm one of the MPP alumni. And today is my pleasure to share my experience doing MPP with IMU. Okay, so before I move on, with the experiences, I would like to share my journey, how I became lecturer and joined IMU. So it all began with my father because he's from the medical background and spent most of his time at the dispensary. So I used to follow him to work when I was young, and this very experience influenced me to choose pharmacy as my career option. So once I've completed my foundation study, I pursued my degree at Masa University. So due to my eagerness to know more about pharmacy and the role of pharmacy, so I used to work at a retail pharmacy during the semester break in year 3 and year 4, and continue to do so even after completing my degree and while waiting for my post placement at the ministry. So in 2017, so I got to do my PRP at Hospital Batu Gajah Perak. So after completing my PRP, I joined Hospital Serdang in 2018 to complete to do my FRP. So the thing is, I was so lucky. So I get to absorb and got offered a permanent post, and that's how I get transferred to Negeri Sembilan to work at PKD Tampin. So I was working at Klinik Kesihatan Jelai. It's a Felda area. People are very nice there. So after that, along these years, my interest, due to my interest and also to do research and to pursue my career, I switched my career pathway to academics. And that's when I got an opportunity to be a lecturer at IMU. So I quit my job and then joined IMU in 2022 December. So what motivates me to advance myself? So I believe that, doing bachelor degree in pharmacy, it's challenging. So by the fourth year, you feel like, am I gonna do this? And then once you start your work, then it's the work and the commitment. It's just like the idea of pursuing a master's it looks like far-fetched. But despite of this, I decided to continue my postgraduate because I want to advance myself and also the opportunity that comes along with the postgraduate degree. So what I meant by this is that once you have a postgraduate degree, the career ladder, you can climb up faster. Let's say if you are working at a hospital, whether it's in the government or a private, you get to be working as a clinical pharmacist or a ward pharmacist, depending on the facilities that you work. And let's say even if you are working at a clinic kesehatan or a primary healthcare, even then you still can practice as a clinical pharmacist. There are some facilities, clinic kesehatan, where they allow the clinical pharmacist to develop the clinical unit. That means they allow them to have the TDM services in the area that they wanted. So secondly, I believe that learning is a lifelong process. So it can be formal or informal. The informal way is that the working experience that you get day to day is where you learn more. So a lot of you realize that after 4 years, the knowledge that you get while working will be even more. So this MPP will be an added benefit to the existing experience to everyone. So why particularly clinical pharmacy? As Dr. Palani shared, there is a 4 stream. Why I particularly choose clinical pharmacy is due to the working environment that I was posted in. So previously I was working in Klinik Kesihatan Jelai. So this was a Felda area. So the interesting thing about the Felda area is the kind of patient that I see on day-to-day basis. So most of the patients here are elderly people, not less on children and also the pregnant women. Most of them are around, I would say, 90 to 95% of the patients are elderly patients. So what it had made is that so the kind of pharmacotherapy services that we need to provide to the patient has to be tailored to them. So this includes that making sure the dosing, the frequency, the kind of medication that you prescribe to them has to be tailored to them. So sometimes like certain medication, normal adults, the young adult, when they take the full dose, let's say for example, glyclazide, if they take 160 mg BD, it will be fine. But if you give the same amount of dose to a very elderly patient, they tend to experience hypoglycemia. So these are the kind of changes that as a pharmacist, you might have to be very particular about. because sometimes because of these side effects, the patient might not be compliant to the medication. So these kind of scenarios, the years after years, so this has made me to be more interested towards the geriatric population. So of course, on my own, I do a lot of reading, but how the MPP helped me to focus on my area of interest is through doing a lot of research in the geriatric pharmacy. And I have to agree that doing pursuing your postgraduate study while working, it's a challenge. It's not an easy task, it's definitely a challenge. So how I did is that because the working hours are fixed, that means I'll be working 8 to 5, Monday to Friday. So what I do is that after 5 o'clock, I forget about my work and I just focus on my studies. So depending on the nature of your job, it's best that you tailor it accordingly. And so that would how I go about it. So the second thing is the assignment submission. So it's not that every day you'll be at your best. There are some days you just like, oh my God, I'm so tired. I just want to go and rest. And I have no a motivation to do the assignments. So this is where it's a challenge because you have a deadline to meet and you have to submit the assignments. So what I told myself is that, and I push myself is that at least do a part of it, like at least some part, or do a paragraph. Just write one paragraph at least a day, so that when it almost there, the deadline, you're able to finish it and submit it. So the good thing about IMU is that they do give you enough time to work on the assignments. It goes even up to 1 month, so that you have enough time to gather all the information, the necessary information, and to work on the assignments. So as a part of the clinical pharmacy program is that the clinical attachments. So the clinical attachment, it will go up to 6 weeks. And then either you can do it at your own place and also at other places. So I choose to do in a tertiary hospital. So the thing is that when I have to go for clinical attachment, I was so worried because I have to leave behind my work. And also I feel that I'm leaving my colleagues alone because it's the group that we have, we have around like 2 to 3 hours, and if I left, it's just 2 of them. So when I told this to my boss, he was very supportive. He told that, okay, Priya, you just go continue. You don't worry about this one. I will send someone to cover for you the meantime. So it's important to have support from your co-workers and also your family members to complete the clinical attachment and also the other attachment on time. And the things that I enjoy about MPP. So the first thing that comes to my mind is the interactive classes that I have. So the thing with MPP is that the classes are not very theoretical or very formal where the lecturers talk and then you just sit and listen. It wouldn't be like that. It will be, they will give some introduction and then it will be all on discussion. So everybody will gathering because most of us are working adults with experiences from different industry. We will come together and we share our opinions, feedbacks, and it will go up to 1 or 2 hours. We will just enjoy the session. And the second thing is that, like what Dr. Palni has said, there's no end semester exam. So this, when my friend told about this, I was like, huh? Are you sure you don't have end semester exam? So then I got very curious. So how is the assessment going to be? So she was explaining to me about this, and it was very interesting because I no need to memorize so many things, and then dump it on a paper. So the assignments is going to be assignment based in course assessments, where these assignment mostly will help you with the critical thinking. So mostly it will be application based. So whatever that you learn and how are you going to apply it in a real life situation or even in your workplace. So the next one is, So the next one would be the things that I enjoy is the encouragement that I got from the teaching faculties. So, when I joined MPP, I was pretty clueless because I don't know how to go about it and then managing it and then how am I going to complete it on time. But the support that I got from them and also the guide, it's helped me a lot and able to complete it on time. So how big the support I got is that I joined as a part-timer and I able to complete it as a full-timer. Like I decided to do 2 to 3 years. That was my target. And after getting the support and the guide from the teaching staff, I able to complete it in a year. So they are very supportive and they are very nice. So another part that I enjoy is the research and publication. Me as a person, I love to do research. I love to do write-up. So when I joined MPP, this was like the last year, another article, I able to publish these 2 articles. This is very dear to me and very personal because it's the research that I've done in the area of my interest, which is dealing with the geriatric population. So it means a lot to me. And also going for conferences. I am someone who like to go to conferences because I want to know what is out there, what's new, and what I can learn from them. So the good thing about IMU is that they do support you and they do bear the costs for the fees. So because of this, I'm able to attend few of the international and local conferences. So there's 3 in total. One is the FAPA conference, the IPOS that is in collaboration with IMU, University of Tokyo, and also UITM, and the last one is from India. So out of 3, I'm able to win 2. The one that I joined in India and also the IPOPs. So this was like amazing. These are I would say the highlights of my career. So the next one is how the experiences helped me in the sense that I would categorize it into 2. One in terms of my work, another one is in terms how I grow as a person. So when it's come to work is that I realized that I become very detail oriented, that compared to how I was before I started MPP and after I started MPP, it's different. So to day, I become detail oriented. Everything I do, I make sure that there's no error, and then whatever the information that I provide to the doctors, I make sure it's of evidence based. And and also I'm able to provide better service to my patients. And when they ask me questions, sometimes it's very related, very technical, I'm able to answer it and I'm able to convince them. That's the most important thing for me. And as a person, I would say when I started MPP, I did a lot of self-reflection because I was so focused on my work and also my studies. And that's where the self-reflection started. I asked myself what I want out of a career, or like a job, or what I want in general, or after this, where I want to go. So my interest to do research has always been there, even when I was doing my bachelor degree. But the thing is, I didn't give much of a thought about it. I was just going along with it, and also joining the hospital and also clinic kesihatan and so on. But once I joined MPP, it rekindled my interest back. Oh, this is it. This is what I want to do. Research is what I want to do. Is to do more, and that's how I told, okay, let me join the academics. And that's when my career pathway switched from the services side to the academics. And I would say I really enjoy being an academician. Okay, so that will be all. This is my co-workers back when I was working at Clinic Kesehatan. Very nice people, amazing. I wouldn't have completed and do what I do without them. So I owe it so much to them. So with this, I would like to end my experience sharing with everyone. Thank you.
All right. Thank you very much, Priya. Yeah. All right. I hope everyone who are listening here get some sense of, what journey Priya has actually have actually obtained from the Master of Pharmacy practice. All right, so I'm going to just go through some of the questions that's been put up. And of course, those of you who still have any questions, please remember, just put into the Q&A panel. We'll try to answer as much as we can. All right. So, we have one of the questions was asking whether if Master of Pharmacy practice currently offer any dual degree. So I assume what they're trying to refer it is whether it offers any credit transfers, just like how our Bachelor of Pharmacy, IMU Otago at the moment. All right. Maybe Dr. Palani want to highlight a little bit or explain a little bit at the moment.
Thank you, Dr. Besi.
Yeah.
Hi, thank you for the question. Actually, very good question. But actually, we are not offering any 12 degree, currently, and maybe we'll try to offer in future. But currently, we do not have any 12 degree option.
Yeah. All right. Okay. Yeah. And there's another questions which actually asked about pharmacy management stream particularly. Whether there have been any alumni who did a pharmacy management stream currently working in hospital pharmacy. And of course, if there is any, whether you could actually give some sharing on, how does the course help, the person or the alumni themselves or the students themselves. Yeah.
So another very good question from the students, from the audience. Yeah, actually, we have 40% of our the MPP students have selected the pharmacy management stream. And we have very good students, in the pharmacy management stream, and many got higher position. Okay, and notably, I can say one of our MPP students, she was, while studying the MPP program in the pharmacy management stream, she was working in a clinical hospital, Jogor, Medini Jogor. Okay, and she informed the management, I'm doing pharmacy management. Okay, then she completed the degree. At the same time, she got opportunity to work in Sunway, Kuala Lumpur. Okay, and she got a higher position, and she shifted from Jogor to Kuala Lumpur, and now she's working in Sunway. Okay,
All
so
right.
one of the she got a higher position, and many of our pharmacy management stream students got higher position the managerial level, not only in Malaysia, even abroad as well. So we have a couple of evidences.
Yeah. Oh, that's nice to hear. Priya, do you recall any one of them, or do you know any one of them who currently are working on that areas?
I think if I'm not mistaken, Hassan, Dr. Pali, did Hassan take the pharmacy management? Yeah.
Yeah, Hassan pharmacy management also Sokme.
Sokme,
yeah. Now she's working in Sunway.
Yes. So Hassan, as I remember, he's working in Sudan now, and also got the pharmacy as he's managing there now. So that is the feedback that I got from him when I last chatted.
Yeah. Another one student from Emmanuel, he's working in Nigeria now, and he's working as a regional manager in the pharmacy sector.
Yeah. So obviously it's not just the local, Malaysian students. So we have actually quite numbers of international students that benefited from the course that they have undertaken. So it's very much depending on what the students wanted. Since we are talking on this area itself, and of course I know Priya has shared a little bit about why she has selected clinical pharmacy. Perhaps maybe Dr. Palani can give a bit of sharing, what are the other reasons, or what are the common reasons why usually students come in and do or advance themselves in a postgraduate studies like Master of Pharmacy practice. Do you have any ideas that you could share?
Thank you, SP. It's a very good question, actually. Actually, if you see, nowadays the bachelor degree is not sufficient, not enough. Now they are getting more, advanced, and they need to get some higher position. If you want to get higher position, they need some higher degree. Okay, so that's why they're looking for some master degree and with flexible options, because most of our students, if you see, around 80% of our MPP students are working adult. Okay, so they don't want to compromise their professional duty, and they're working adult. They may be a parent, they may have family, kids, or so in that case, they wanted to study at the same time they wanted to work, they wanted to serve to the family as well. So our program, Master in Pharmacy Practice program, it's a blended delivery program, and we are offering 60% online and 40% face-to-face. So even the 40% classes, even if we are offering 40% face-to-face, but it will be delivered in weekends. So weekend they can spend the time for the studies, and weekdays they can spend time for the family as well as professional duty. So without compromising even a single area, they can take up this program and complete, and they can get their degree. So that is one of the main things. Then another one is the university. The brand name will speak. Wherever we study, the university name will speak. Oh, these students. Right. So IMA is a very good university, well-established university, and we produced thousands of the proud alumni, proud graduates. They are working locally as well as internationally, and also they are working in top level. Even if you see in Malaysia also, the IMA students are working top level. Wherever you can go, you can see. So this is another one, the brand name. Okay, and also the flexible options. Okay, they can choose a full-time as well as part-time. Even if you see Priya, she was working as a full-timer in a clinical area, and she was registered. She has registered this program as a part-time student. Then she started taking module one by one. Then she realized that, oh, I can complete the module on time. So she completed all the modules as a full-time student and graduated and got the degree with a distinction. So that is one of the main.
Yeah, that's amazing. That's amazing. Yeah. So Priya, do you have anything that you like to share on that aspect? Like, why, or, what makes others, people who have undergone this master, actually do advance themselves? Anything that you want to add on that?
Well, actually, I got to know about this program MPP through MPP alumni themselves, and one of them is my childhood friend during the school time. So Sharmila. So Sharmila, I know her when I was during the secondary school. We grew up in Kajang. We ended up choosing pharmacy, and she got the JPA scholar, and then she did MPharm with IMU actually, and then she continued her MPP here as well. So I got to know about MPP from her. So she was explaining about all this program, and then and also another person that I would like to is Miss Nitya. So both of them are actually working now in Hospital Tuanku Ampuan Najiha in Negeri Sembilan, and both of them are clinical pharmacists now. And so one of the reasons they're able to get into the clinical is with the MPP degree actually. So I'm actually very happy for them with their advancements actually in career.
Yeah, thank you, Priya. Priya, you did mention just now a little bit, like, why have you decided on clinical pharmacy and all that? I'm just very curious, at the point that you actually decided to advance yourself into clinical pharmacy, do you have in mind what are the next career progression that you're going to move into already with this master, or you're still a bit, unclear about how it goes, but you're just going on, going by the flow in that sense? Yeah.
Well, my initial idea is to be in a clinical, but the thing is, when you have like more information, more ideas, where there's a lot of self-reflection that make you like, okay, why not this? And it will go back to yourself, ask, is this what you actually want? And when I started with MPP, so in the beginning, yes, I would like to go back in the clinical, but as time flows, with more information, with more options that comes along with it, then it became more clearer that what actually I wanted to do, what makes me happy, and I pursued that actually.
Yeah,
so that's when the switch happened actually.
Yeah, I like to actually concur what Priya has mentioned as well. And of course, all three of us, myself, Dr. Palani, myself, even though we are not doing the Master of Pharmacy Practice in IMU, we have a postgraduate degree ourselves. Yeah, I think it's quite true that whether we are talking about ourselves or others that we met, a lot of students who undergo and advance their master in a postgraduate studies may not actually at first know where they are heading in that sense, but there is this burning sensation to advance yourself, with the idea that I might want to advance myself and go into this area, and that's the first thing I'm going to do. But it's amazing that as you're undergoing that journey and you have done a lot of self-reflection, because it allows you to look and see things in a different ways. And that's when we realize that, there are many doors that you can open, and that's how it enlighten you on that. But I also want to share with you that some of the students who actually that I've encountered, that have entered Master of Pharmacy practice, they are very much because they wanted a career switch, so they came in with the ideas that maybe they've been in the clinical for too long, for example. I'm just giving an example, but they wanted to do something else, so they would like, and they are not confident they're able to do it in that sense, because they have been out from that career path for a very, very long time. So they took up the course just to give themselves another chance to advance into another area and see whether that's something that they want. So that's another reason, perhaps sometimes, for those of you who are still a bit, puzzling and not sure where you're heading and all that, so I would advise that, or maybe I should ask Dr. Palani, do you have any specific advice that you want to give those, those who are here, or maybe others, who are having still some dilemma, example, which stream to choose from, what, yeah.
Actually, if you see our MPP program, consistently we are getting good number of students every year. Okay, that is one of the success. How we are achieving this success means we are delivering the program as a part-time, and if you have some workload, if you are working in a hospital, maybe community, wherever you are working, if you feel that you have lot of workload in a particular time, at the time you can choose either one module instead of selecting all the modules. And that is one of the things, even many of our students towards the year end, they will be working for the audit, or maybe the closing all the tasks, everything. At that time, they will choose one module. And maybe year beginning, or maybe in the middle of the year, they may have a lot of free time. So they will take 2 or 3 modules. So like that, we are giving option for the students to choose a module, and we are not forcing them, okay, I have to choose all the modules at a time. You can choose one module, or maybe you can choose 2 modules according to your convenience, according to your free time, you can choose a module. Okay. So they're choosing their own pace. Okay, I want to complete the degree in 2 years, or maybe 3 years, or 4 years. But once they enter inside the program, so they know that, okay, it's more flexible and the teachers are very helpful. So instead of whenever they take one module, the next semester they used to take 2 modules or 3 modules. So like that, they are adding the module and they're completing on time as well. Okay. And if you have some dilemma, which stream I can choose? Okay. So you may have some idea, I want to become in this position after 5 years, or maybe after 3 years. Okay. So everyone will be having some target. Okay. So we want to work in a multinational company, or maybe we want to work in a hospital. We can't stick in a particular position for a long period of time. We need a growth. Okay. So if you want to grow in an organization, or maybe if you want to grow in your position, you need some higher degree. Okay. The quality we have to develop first, then only we can aim something. Okay. So if you want to get some, position in the clinical area as a clinical pharmacy manager, or maybe clinical pharmacy expert, or maybe as a true ward pharmacy clinical pharmacist, then you can choose clinical pharmacy stream. Okay. So you can go higher position with the clinical pharmacy stream. Let us say, for example, you don't have any clinical pharmacy background, you do not work in clinical pharmacy, but you want to work in community pharmacy. Okay, again, you can work as a community pharmacy manager, you can work as a chain of pharmacy manager. Even community pharmacy is a very big field in Malaysia. Okay, very big business market. So you can work as a manager and you can go higher level. Okay, then wellness consultant, even pharmaceutical marketing. So pharma marketing agency, then there are a lot of opportunities. And many students, they think, oh, I want a master degree with a business background. Many are going for MBA, right? But MBA, if you see MBA program, it's a whole purely a business related one. Okay, but what we offer in our master in pharmacy practice program, it's a pharmacy management. Okay, all the management related to pharmacy. So pharmaceutical marketing, entrepreneurial leadership, personal management, human management, everything related to pharmacy. So when you have a degree, the management degree that is focusing mainly on the pharmacy related area, then the opportunity is very, very wide. If you go to MBA markets, okay, there are, for a single MBA post, a lot of people will come. MBBS with MBA, bachelor degree with MBA, BSc or any arts and science degree with MBA, then dentist with MBA, pharmacist with MBA. So the demand is less, but the supply is more. But here, when you have a master degree with the pharmacy background, pharmacy management, you can go higher position when compared to any other people. Even if I'm an entrepreneur, I want to choose some student with a pharmacy background. I will choose only the student with a pure pharmacy background. They know what we can do in the pharmacy hub. Right. Again, if you go for clinical research, so many of our students are working in the clinical research area because now the clinical research is blooming now in Malaysia. Now there are a lot of hospitals that are trying to tie up with the international companies to do the clinical research. Okay, recently even some of the two big hospital, one from Kuala Lumpur, another from Sabah, they signed the MOU to have the clinical trial. So now these students, they can work in that area, clinical research area, in the human trial. Okay, so if you want to work related to the research or maybe scientist or say discovery, then you can choose the clinical pharmacist, clinical research stream, and you can work as a CRA or maybe CRO, and you can excel it. So if you have any doubt, no worries. Actually, you can ping me. I will give you in-depth information to you. I will give you a lot of evidences and also proper advice to you to choose a stream.
Yeah. So here. So just remember, if you have any dilemma on the stream, I think the least things that you have to worry is on that. Just contact us, so that we can have a dialogue session. We can discuss through and see what might be a suitable stream for you to pick up. Okay, we have one question that perhaps that we can look to where they would like to know whether it's possible to switch stream upon initiation of program. So which means that if let's say the students have first signed up one stream and later at a certain point the student would like to switch to a different stream.
Yeah, it's possible. Only one time. Okay. And if you have some of the modules are very common module across the stream. Okay. For example, research methodology module is a common methodology module for all the streams. Okay. If you have selected only the research methodology module and you have completed that and you want to switch over to other stream, still is possible because it's a common module. And if you see another one, evidence-based practice, this evidence-based practice module is a common module for 3 streams. Okay. Except pharmacy management. Okay. So if you have selected completed research methodology as well as pharmacoeconomics, then if you want to switch over to some other stream, yes, possible. Only one time you will allow.
All right. So I mean, can I sort of like understand by if the students have actually done some common stream, when they switch, they are exempted from doing that module again. Yeah. They just have to take the module where it's specialized for that particular stream again. Yeah. Am I right to say that?
Correct.
Yeah. All right. Okay. So students, for those of you who are here, yes, you can actually switch stream. It's just that you are allowed to only be able to switch one time. And of course, upon switching, you will need to take up some of the modules where it's relevant to that particular stream. But there are also some common modules that you do not need to repeat again. You could just use the same module credit, for the master. Am I right to say that?
Yeah, correct.
Yeah.
So some of the modules are very common module. If you have completed the common module, then no problem. You can switch over only one time. But if you have selected some other stream specific module and you have completed that, then you can switch over.
Oh, they are not allowed to switch, even though they are willing to take up the module, extra modules? Cannot. Okay. So there is also depending on how far they have gone into the program then.
Yes.
Am I right to say that?
Yes.
Okay.
Yes.
All right. So I think upon switching and upon signing up, and if you are still puzzling and you are considering that, please make sure you speak to Dr. Palani and of course understand at what point is that you're no longer allowed to switch in that sense. Yeah.
Sure.
Okay. All right. But perhaps one more thing that we could discuss a little bit is about the research. Yeah. All right. So obviously Priya did a very good job in doing her research and all that. Perhaps can you share with us a little bit about what are the research? How is it the research like in Master of Pharmacy practice?
The thing that I would say that it's also an advantage with IMU is that it's very structured and it's very supported. That means the student, like, they wouldn't be like entirely alone figuring out everything on their own, doing like how to go about this, how to do this. It will be guided through from beginning till the end, and it's very structured. And the student don't need to worry about it. We do have like a support group within each supervisors that you can actually liaise with and you can ask them. So like for me, with my supervisor and the other students under his supervision, we have a close connection with each other where we help each other out, so that none of us has to feel alone doing the research actually.
Yeah. So Dr. Palani, would you like to add a little bit about, what are the scope, or are there particular scope or areas of research where students could go into when they're doing Master of Pharmacy practice? Perhaps you can give a bit of idea about that. Yeah. You have muted yourself, Dr. Palani.
Yeah.
Yeah.
Okay. So we are doing research in wide area of pharmacy practice as well as clinical pharmacy area. We do not have any restriction. We have done a lot of research, even patient-centered one, drug utilization, prescription screening. Then if you see dengue awareness and interventional studies, cross-sectional studies, then we do not have any restriction. Because pharmacy practice is a very broad term. And we can work in any area, maybe clinical or maybe hospital or even community, even social, many type of research we have already done. Okay. So most importantly, patient safety related studies, diabetes, hypertension, cardiovascular diseases, and also, telehealth, digital health, then, antibiotic surveillance, then dengue awareness. There are many studies we have done. Okay. So to point out few, even recently we have started the fall prevention. So geriatric research very, very less in Malaysia. Even, very notable finger cone researchers, they started doing the geriatric research. Now we take up that area, and we have done already a lot of research in geriatric as well. We are doing a lot of research in fall prevention. There are so many things that are going on now.
And a lot of this research happened in the student-owned particular workplace, isn't it?
Yeah, correct. So it depends on the students' interest. We are giving opportunity for the students to choose a topic. Some of the students are very interested in choosing maybe cardiovascular disease, diabetes, or maybe they wanted to choose on patient safety or anything. Wherever you wanted to do the research, you can discuss with our potential supervisors. We have list of potential supervisor. We have the profile of them, even the Google Scholar, even PubMed. All the links we will provide. So you can go through their profile, based on their profile, and if you feel that supervisor is more suitable for you, you can discuss with them. Okay. And if the supervisor is not suitable, and we will guide you, okay, who will be the best person for you to do the research. So all the support service will provide to choose a topic as well as to choose a supervisor.
Yeah.
And most importantly,
go on.
We are giving a research grant for each and every student. Okay. Even when you see, this is a notable point in IMU. So IMU is giving 10,000 ringgit for all the master students, especially MPP students, to do the research. So you can use that 10,000 ringgit as a research expense, either maybe purchasing some items, maybe equipment. Even you can use that money for publishing the papers. Okay. So whatever you pay the money, it's worth a penny. Okay, you are getting a very good degree, as well as you are going out with the publication as well as a research grant. Okay, so whenever you go out in the job market and you say, I got 10,000 ringgit as a research grant in your CV, that's a very big weightage. Right? And also publication, because at the end of the day, we encourage the students to publish. Okay, if you see Priya, she already published 2 papers. All our students are publishing the papers. So it is one of the things. They can choose a topic. We are not only giving option for them to choose a topic, we are giving option for choose a supervisor and also choose a publication. Come with the idea, go with output.
Yeah. Hope that gives every one of you some idea about the research. One last question, when do students who sign up for MPP need to select their area of specialization? Must they select at the beginning?
They need to select the area at the beginning, the stream at the beginning. If you have any doubt, no worries. Okay, we will have a meeting. Okay, so even I used to conduct a lot of meetings every day with the students. They will apply to IMU, to the admission office, but they may not know which stream will be more good for them. Okay, at that time they will come to me, Dr. Palani, I don't have any idea. Can you give some idea how to choose a stream or which one will be more suitable for you? I will give appropriate advice. They will go and discuss with their peers. Okay, and finally they will come with a conclusion. Okay, so we are helping them to choose the stream as well as the module. Even, last week, actually, we had some query from the students. And Dr. Pauline, can you advise me to choose the module? Which module I can choose for the next semester? They're already a current student, but they don't know which module will be more suitable for them. Okay, because they need to think about the assessment and the time required for preparation. So I will provide appropriate advice. Even not only me, when all the faculty members in the MPP program, they can able to provide advice for you. So you're not alone. We are with you to help in each and every steps.
Yeah. So thank you very much. I think we shall end the session here since it's already 9:30. So thank you very much again to our both speakers who are here today. And of course, very importantly, also thanks to all of you who have attended this webinar. I hope that it's helpful for you to get some ideas about our master pharmacy practice. And of course, just to highlight again, if you have any uncertainties, you want to know more about the stream, the detail, you wasn't sure what to choose from and things like that, don't worry. Just write into IMU, okay? Contact our marketing or admission office, and they can actually direct you to the lecturers, example, Dr. Palani, myself, or even other lecturers to give you more advice about the program. So don't feel that you're alone, and if you're unsure what to do and what to choose at the end. Okay, so here I shall end the session by saying thank you very much, and of course, good night and take care, everyone.